Chapter 4 Reproductive Health 1. According to WHO, reproductive health means well-being in which four aspects of reproduction: physical, emotional, behavior, social, physical, emotional, behavior, social, physical, emotional, behavior, social. 2. Family planning programs were initiated in India in the year 1950. 1950. 1950. 3. India was not among the first countries who initiate family planning. F. 4. RCH full form: Reproductive and Child Health Care. Reproductive and Child Health Care. Reproductive and Child Health Care. 5. Only government agencies have taken steps to create awareness regarding reproduction-related problems. F. Non-government agencies have also taken steps. F. Non-government agencies have also taken steps. F. Non-government agencies have also taken steps. 6. Friends have a role in the dissemination of reproduction-related awareness. T. 7. In amniocentesis, fluid is collected. Amniotic fluid, amniotic fluid, amniotic fluid. 8. Statutory ban on for sex determination because of increasing feticides. Amniocentesis, female. Amniocentesis, female. Amniocentesis, female. 9. Amniocentesis is used to test the presence of disorders like Down syndrome, hemophilia, sickle cell anemia. Down syndrome, hemophilia, sickle cell anemia. Down syndrome, hemophilia, sickle cell anemia. 10. Scientist developed Saheli at Central Drug Research Institute, CDRI. Central Drug Research Institute, CDRI. Central Drug Research Institute, CDRI. 11. World population was billion in 1900 and billion in 2000 and in 2011. 2 billion, 6 billion, 7.2 billion. 2 billion, 6 billion, 7.2 billion. 2 billion, 6 billion, 7.2 billion. 12. India's population was at the time of independence, crossed 1 billion in and was in May 2011. 350 million, 2000, 1.2 billion. 350 million, 2000, 1.2 billion. 350 million, 2000, 1.2 billion. 13. Through our Reproductive Child Health (RCH) program, though we could bring down the population growth rate, it was only marginal. 14. Population rate of India was less than % according to the census report of 2011, which is a lot. 15. A rapid decline in maternal mortality rate (MMR) is one of the reasons for increasing population. 16. Marriageable age of female and males in India is: female 18, male 21. Female 18, male 21. Female 18, male 21. 17. What are the features of an ideal contraceptive? User-friendly, easily available, effective, reversible, no or least side effects, should not interfere with the sexual drive. User-friendly, easily available, effective, reversible, no or least side effects, should not interfere with the sexual drive. User-friendly, easily available, effective, reversible, no or least side effects, should not interfere with the sexual drive. 18. Name all the methods of contraception: natural, traditional, barrier, IUDs, oral contraceptives, injectables, implants and surgical methods. Natural, traditional, barrier, IUDs, oral contraceptives, injectables, implants and surgical methods. Natural, traditional, barrier, IUDs, oral contraceptives, injectables, implants and surgical methods. 19. Identify the contraceptive shown in diagram. I, A and B. Diagram. I, condom, A, for male, B, for female. Diagram. I, condom, A, for male, B, for female. Diagram. I, condom, A, for male, B, for female. 20. The device shown in diagram 2 is copper T cut, copper T cut, copper T cut. 21. Identify the contraceptive shown in diagram 3. Diagram 3. Implants. Diagram 3. Implants. Diagram 3. Implants. 22. Example of a natural method: periodic abstinence, coitus interrupts, lactational amenorrhea. Periodic abstinence, coitus interrupts, lactational amenorrhea. Periodic abstinence, coitus interrupts, lactational amenorrhea. 23. Couples avoid coitus from day to the menstrual cycle in periodic abstinence. 10 to 17. 10 to 17. 10 to 17. 24. Fertile period in the human female is from to day 10 to day 17. Day 10 to day 17. Day 10 to day 17. 25. Dash is a method in which the male partner withdraws his penis from the vagina just before ejaculation. Coitus interruptus. Coitus interruptus. Coitus interruptus. 26. Coitus interruptus is also called withdrawal interruptus. Withdrawal interruptus. Withdrawal interruptus. 27. What is lactational amenorrhea? Absence of menstruation during the lactation period. Absence of menstruation during the lactation period. Absence of menstruation during the lactation period. 28. Lactational amenorrhea is effective only up to dash months following parturition. 6. 29. The side effects of the natural method are almost nil. 30. The chances of failure of natural methods are also high. 31. Dash method works on the principle of avoiding chances of ovum and sperms meeting. Natural. 32. In dash method, ovum and sperms are prevented from physically meeting with the help of barriers. Barrier. 33. Dash is a popular brand of condom. Nirod. 34. Nirod is for male, female. Male. 35. Condoms are made of thick, thin dash or dash. Thin rubber, latex sheath. Thin rubber, latex sheath. Thin rubber, latex sheath. 36. Condoms also protect from dash and dash. STI and AIDS. 37. Dash are also barriers made of rubber inserted into the female reproductive tract. Diaphragms, cervical caps and vaults. Diaphragms, cervical caps and vaults. Diaphragms, cervical caps and vaults. 38. They cover dash during coitus. Cervix. 39. Diaphragms, cervical caps and vaults are reusable. 40. Things used along with these barriers to increase their contraceptive efficiency are spermicidal creams, jellies and foams. Spermicidal creams, jellies and foams. Spermicidal creams, jellies and foams. 41. IDs are best as they give privacy to the user. 42. IDs are inserted in uterus. 43. Tell the three types of IUDs. Non-medicated, copper-releasing and hormone-releasing. Non-medicated, copper-releasing and hormone-releasing. Non-medicated, copper-releasing and hormone-releasing. 44. Example of non-medicated IUD. Lips loop. 45. Example of copper-releasing IUDs. Cut, Q7, multiload 375. Cut, Q7, multiload 375. Cut, Q7, multiload 375. 46. Example of hormone-releasing IUDs. Progestacet, LNG20. Progestacet, LNG20. Progestacet, LNG20. 47. IUDs increase the dash of sperms. Phagocytosis. 48. Function in IUDs suppress sperm motility in the fertilizing capacity of sperms, suppress sperm motility in the fertilizing capacity of sperms, suppress sperm motility in the fertilizing capacity of sperms. 49. Hormone-releasing IUDs make the uterus unsuitable for dash and cervix hostile to dash, implantation, sperms, implantation, sperms, implantation, sperms. 50. Dash are ideal contraceptives for females who want to delay pregnancy and or space child. IUDs. 51. IUD is one of the most widely accepted methods of contraception in India. 52. Progestogen and progesterone are the same thing, i.e., they are synonyms. F-progesterone is a type of progestogen, F-progesterone is a type of progestogen, F-progesterone is a type of progestogen. 53. Oral administration of either dash or dash combinations is another contraceptive method used by females. Progestogen, progestogen estrogen. Progestogen, progestogen estrogen. Progestogen, progestogen estrogen. 54. Pills have to be taken daily for a period of dash days. 21. 55. We should start taking pills within the first dash days of the menstrual cycle. First 5. 56. A gap of days is given between pills. 7. 57. What pills do? I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. 58. I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. I. Inhibit ovulation. E. Inhibit implantation. E. Alter the quality of cervical mucus to retard entry of sperm. 58. Pills are very effective with lesser side effects. T. 59. Pills are well accepted by females. T. 60. Dash is a new non-steroidal oral contraceptive drug. Saheli. 61. Saheli is a once a dash pill. Weak. 62. Saheli has very few side effects. T. 63. Progestogens alone or in combination with estrogens can be used by females as dash and dash. Injections or implants. 64. Injections and implants have much longer effective periods than pills. T. 65. Emergency pregnancies can be prevented by 3 ways administered within HRS of coitus. Name the 3 ways. 72 hours, 3 ways, administration of progestogens or progestogen-estrogen combinations or IUDs. 72 hours, 3 ways, administration of progestogens or progestogen-estrogen combinations or IUDs. 72 hours, 3 ways, administration of progestogens or progestogen-estrogen combinations or IUDs. 66. Identify the sterilization procedures shown in diagram. 4. A and B. Label X and Y, diagram. 4. A. Vasectomy. B. Tubectomy. X. Vas deferens cut and tied. Y. Fallopian tubes cut and tied. Diagram. 4. A. Vasectomy. B. Tubectomy. X. Vas deferens cut and tied. Y. Fallopian tubes cut and tied. Diagram. 4. A. Vasectomy. B. Tubectomy. X. Vas deferens cut and tied. Y. Fallopian tubes cut and tied. 67. Surgical methods are also called dash. Sterilization. 68. Sterilization is the terminal method to prevent pregnancy. T. 69. In vasectomy, a small part of dash is removed or tied up through a small incision on dash, vas deferens, scrotum, vas deferens, scrotum, vas deferens, scrotum. 70. In tubectomy, a small part of dash is removed or tied up through a small incision in dash or through dash 5 fallopian tube, abdomen, vagina, fallopian tube, abdomen, vagina, fallopian tube, abdomen, vagina. 71. The technique with high effectivity but poor reversibility is vasectomy, tubectomy, vasectomy, tubectomy, vasectomy, tubectomy. 72. Contraceptives are not regular requirements for the maintenance of reproductive health. T. 73. What is breakthrough bleeding? Vaginal bleeding during normal days, non-menstrual days, vaginal bleeding during normal days, non-menstrual days, vaginal bleeding during normal days, non-menstrual days. 74. Side effects of oral contraceptive pills are nausea, breakthrough bleeding, irregular menstrual bleeding, breast cancer, trick, NABIC. Nausea, breakthrough bleeding, irregular menstrual bleeding, breast cancer, trick, NABIC. Nausea, breakthrough bleeding, irregular menstrual bleeding, breast cancer, trick, NABIC. 75. Nearly -to million MTPs are performed in a year. 45 to 50. 45 to 50. 45 to 50. 76. This accounts for dash of the total number of conceived pregnancies in a year. 20. 77. MTP is also called induced abortion. 78. Government of India legalized MTP in the year dash. 1971. 79. MTP is safe till dash weeks. 12 weeks, first trimester. 12 weeks, first trimester. 12 weeks, first trimester. 80. MTP cannot be done legally after 12 weeks. F. 81. According to the MTP Amendment Act 2017, for MTP of pregnancy between 12 weeks to 24 weeks, how many medical practitioners must be of the opinion, formed in good faith, that the required ground exists? 82. For MTP of pregnancy within 12 weeks, how many medical practitioner opinions are required? 1. 83. Grounds for termination of pregnancy are I. The continuation of pregnancy would involve a risk to the life of the pregnant woman or grave injury to physical or mental health. E. There is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. I. The continuation of pregnancy would involve a risk to the life of the pregnant woman or grave injury to physical or mental health. E. There is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. I. The continuation of pregnancy would involve a risk to the life of the pregnant woman or grave injury to physical or mental health. E. There is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. 84. STUS are also called dash or dash. Venereal disease, a reproductive tract infection. Venereal disease, a reproductive tract infection. Venereal disease, a reproductive tract infection. 85. Name common STIs. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, AIDS. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, AIDS. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, AIDS. 86. Dash is the most dangerous STI. HIV infection, AIDS. HIV infection, AIDS. HIV infection, AIDS. 87. Hepatitis B and HIV can be transmitted by sharing infected needles and transfusion of blood. T. 88. Except dash and dash, other diseases are completely curable if detected early. Hepatitis B, genital herpes and HIV, hepatitis B, genital herpes and HIV, hepatitis B, genital herpes and HIV. 89. Early symptoms of STIs include itching, fluid discharge, slight pain, swellings, IFSS, itching, fluid discharge, slight pain, swellings, IFSS, itching, fluid discharge, slight pain, swellings, IFSS. 90. Females infected with STIs may often be asymptomatic and hence, may remain undetected for long. T. 91. PID full form. Pelvic inflammatory diseases. Pelvic inflammatory diseases. Pelvic inflammatory diseases. 92. Complications of STIs are PID, abortions, stillbirths, ectopic pregnancies, infertility or even cancer, TRIC, PASEIC. PID, abortions, stillbirths, ectopic pregnancies, infertility or even cancer, TRIC, PASEIC. PID, abortions, stillbirths, ectopic pregnancies, infertility or even cancer, TRIC, PASEIC. 93. STI incidence is high in the age group 15 to 24 years. 15 to 24 years. 15 to 24 years. 94. ET full form. Embryo transfer. Embryo transfer. Embryo transfer. 95. ZIFT full form. Zygote intrafallopian transfer. Zygote intrafallopian transfer. Zygote intrafallopian transfer. 96. IUT full form. Intrauterine transfer. Intrauterine transfer. Intrauterine transfer. 97. GIFT full form. Gamete intrafallopian transfer. Gamete intrafallopian transfer. Gamete intrafallopian transfer. 98. ICSC full form. Intracytoplasmic sperm injection. Intracytoplasmic sperm injection. Intracytoplasmic sperm injection. 99. ALF full form. Artificial insemination. Artificial insemination. Artificial insemination. 100. IUI full form. Intrauterine insemination. Intrauterine insemination. Intrauterine insemination. 101. Embryos up to 8 blastomeres are transferred in dash and more than 8 blastomeres are transferred in dash. Fallopian tube, uterus. Fallopian tube, uterus. Fallopian tube, uterus. 102. In gift, sperms are transferred to the fallopian tube. F. Ovum is transferred, not sperm. F. Ovum is transferred, not sperm. F. Ovum is transferred, not sperm. 103. In AI, sperms are transferred to the fallopian tube. F. They are transferred into the vagina and uterus. F. They are transferred into the vagina and uterus. F. They are transferred into the vagina and uterus. 104. Dash is the best method for couples looking for parenthood. Adoption. 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 105. Define infertility. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility, given in summary. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility, given in summary. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility, given in summary. 106. Reasons for infertility may be psychological. 107. More often the reason for infertility is the male partner. Male. 108. In ZIFT, early embryos could be transferred into the fallopian tube. 109. Sperm is directly injected into the cytoplasm of the ovum in dash. ICSC. 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 110. Infertility due to low sperm count can be corrected by artificial insemination. Artificial insemination. Artificial insemination.